The US Food and Drug Administration has banned some over-the-counter antibacterial soaps, both bar and liquid, in part because they don't work any better than normal soap and some good old water, and in part because long-term exposure to some of the most commonly used active ingredients may contain its own risk. Indeed, Dr. Janet Woodcock, the director of the FDA's Centre for Drug Evaluation and Research, said, and I quote, "Some data suggests that antibacterial ingredients may do more harm than good over the long term." This is the retail variety, by the way, not the antiseptic products used in hospitals, for example. But the FDA rule applies to 19 active ingredients, meaning it will have a far-reaching impact. Manufacturers now have a year to remove these ingredients from their products or stop selling them. Now, Professor Julian Crane is an asthma and allergies expert, amongst other things, with the Department of Medicine at the University of Otago in Wellington. Whilst obviously he uses the appropriate sterilisers and sanitisers when he's working in a hospital environment, outside of hospital...
I've never bought one and had one at home, no.
And why not?
Well, because, many reasons. I think in most settings, we don't need to sanitize our hands. Now, if you're entering a hospital where you may be transferring nasty bugs from one patient to another, then it's very important. But if you're at home, where you don't have... the nastiest bugs occur in hospitals. At home, they're not nearly so nasty. One doesn't... I've just never... There's no need to sanitize one's hands.
If one felt the need, if you were the kind of person for whom life was easier and better if you were able to sanitize your hands, is there efficacy in these products? Because the FDA is basically saying, actually, a lot of the products that we just buy from the supermarket or whatever aren't doing anything at all.
Well, I think that's probably true. The problem is that, we were designed to live with bacteria, whether they be on our hands or anywhere else. And we're finding bacteria wherever we look. So in places where we thought in the human body were sterile, we now find there are lots of bugs. And so now we're struggling to find out why we have these bugs and what their purpose is. But, we live in a relationship with them, and we shouldn't be wiping them out willy-nilly. Now, of course, there are some bugs that are really nasty, and they're the bugs that have been bred to, have bred themselves to cause problems, and that is an issue.
But your bog standard hand sanitizer isn't going to get rid of those bugs anyway, is it?
No, absolutely. Well, it'll get rid of some of them, but a lot of these products say they kill 99.9% of all germs, but 0.1% of many millions is plenty to keep things going. So. But it's the old story. If you come off your bike and scrape your leg down the road, so that you break the skin, the bugs from there are unlikely to cause you any problem. But if you were to do the same thing, say in in a hospital, you'd be much more likely to pick up nastier bugs, simply because that's where people go when they're sick and when they have nasty infections.
That's Julian Crane, who was with the University of Otago, the medical school based in Wellington, talking to us a short time ago.